All right, let's talk about something that so many people deal with, chronic headaches. But what we're really going to dive into is a cause that surprisingly almost always gets missed.
You know, if you're someone who suffers from headaches that just won't quit, you've probably tried everything, right? But what if the answer isn't another pill or a new diet? What if you just needed to look up? And I don't mean that metaphorically. I mean literally looking up to the very top of your spine. All right, let's get right into it. The unsolved headache. And for way too many people, that's exactly what it is. This ongoing mystery that just completely takes over their life. So does this list look familiar? I bet it does. You go through the whole cycle, right? Prescription meds, drinking tons of water, the blue light glasses, maybe even years of brain scans that always come back normal. It's exhausting, it's expensive, and honestly, it's just demoralizing when it feels like you're getting nowhere. So here's the big question. What if we've all been looking in the wrong place? What if the real problem isn't some kind of chemical thing going on in your head, but a structural problem just below it?
And that leads us to this tiny but absolutely critical part of your anatomy. It's an area that, believe it or not, gets systematically ignored when it comes to treating headaches the conventional way.
We are talking about something called the craniocervical junction. Okay, so what is that? It's basically the spot where your skull meets the top two little bones in your spine, the atlas and the axis. Think of it like the super important bridge between your brain and the rest of your body. And get this, it's one of the most packed areas with nerves in your entire body. And this is where it gets really interesting. According to Dr. David Claggett, an upper cervical chiropractor, this whole area is a massive blind spot for headache and migraine treatment. You know, doctors are often focused on what's going on with brain chemistry, and in the process, the actual mechanical, structural source of the pain can be missed completely.
Okay, so how on earth can one tiny little spot cause such huge problems? Well, let's break down how it actually works. It's a pretty fascinating chain reaction.
Okay, check this out. It's kind of amazing how a tiny misalignment, I mean, we're talking millimeters here, can kick off two totally different types of headaches. So on one side, you have migraines. If that top vertebra, the atlas, shifts a bit, it can pinch the vertebral artery. That reduces blood flow to the brain, and boom, you get that awful throbbing pain of a migraine. But then on the other hand, that same exact shift can tick off the little muscles at the base of your skull. They start pulling on the brain's protective cover, the dura mater. And what does that feel like? That classic, tight band of pressure we all know as a tension headache.
So it's really this simple chain reaction. Step 1, that top vertebra, the atlas, gets misaligned by just a hair. Step 2, that irritates all the arteries and nerves around it. And then step 3, the body freaks out and sends a pain signal. And that's what you feel as a migraine or a tension headache. It's a simple structural problem causing a really complex, painful event.
So, okay, if a misalignment is the cause, does fixing it actually help? I mean, that's the real question, right? Well, take a look at this number.
72%. That's a huge number, and it comes from a study where 72% of migraine patients saw considerable improvement after getting cervical chiropractic care. I mean, those are results that are as good as, or sometimes even better than what you see with medication. And the key difference is, this is pointing toward a real solution, not just managing symptoms.
So when we say correction, what does that actually look like? Because I'm guessing it's not what you're thinking.
Let's be honest, a lot of us hear chiropractor and we immediately picture all that twisting and cracking and popping, right? But upper cervical care is a whole different ballgame. There's no twisting, there's no cracking. It's a super precise, very gentle, low-force correction that's focused only on that spot where your head meets your neck.
In fact, Dr. Claggett says the adjustment is often so subtle that patients are literally like, "Did you do anything?" The proof isn't in some big, loud crack. It's in the quiet that comes after. When blood flow is restored, the muscles relax, and the headaches, well, they finally stop coming back.
And this really changes how you think about pain, doesn't it? A headache isn't just your body malfunctioning. It's a signal. It's your body telling you, hey, something is out of place up here. And if you can correct that structure, well, the body doesn't need to send the signal anymore. It's like you're not just hitting snooze on a fire alarm, you're actually putting out the fire.
So all of this leads to a really powerful and frankly very logical idea about how we should be treating chronic headaches.
I mean, look at this timeline. For so many people, this is painfully familiar. You spend years just cycling through stuff. over-the-counter meds, then prescriptions. Then you finally get referred to a neurologist. Then come the expensive MRIs and CT scans. And after all that, it's more meds, Botox, even nerve blocks. And the whole time, the real root cause could just be sitting there, completely unchecked.
And why does this happen over and over again? It's that blind spot we talked about. Your standard MRI or CT scan, it's designed to look at your brain tissue. It's not really looking at the mechanical relationship between your skull and your spine. So you can have year after year of perfectly clean scans while the actual structural issue is sitting just an inch below where they're looking.
And this really gets to the heart of what Dr. Claggett is saying. Look, this isn't about being against medication. It's just about being logical. Why wouldn't you rule out a simple, non-invasive, structural cause first, before you jump to all the more invasive stuff? A simple check could find an answer that years and years of other treatments completely missed. So here's the big takeaway. An upper cervical evaluation shouldn't be the thing you try as a last resort after everything else fails. When you think about how the body is built, it's a completely safe, non-invasive, and totally logical first step to figure out what's causing chronic headaches.
And that's really the question we want to leave you with. For all the people who have spent years and a fortune looking for answers inside their head, could it be that the solution has been quietly waiting for you right at the very top of your spine this whole time?
I stopped trying to find a doctor who would listen, and I did this instead. For years, I was doing everything right. Eating clean, exercising, getting 8 hours of sleep, but I was still exhausted. I had constant brain fog, and my hormones felt completely out of whack. Every doctor told me my labs were normal, and it was probably just stress. I was about to give up until I found Holistic Health. It's a free AI wellness tool trained by functional medicine experts. I spent 5 minutes answering questions about everything: my symptoms, my sleep, my digestion, and it built me this. And this was the light bulb moment. It didn't just give me a list of problems, it connected the dots. It showed me how my gut health was likely impacting my hormones and how that was causing the fatigue and the brain fog. It even gave me a clear list of potential root causes, supplements to research, and even the specific lab tests to ask for. Its tip is secure. Over 77,000 people have used it, and it's 100% free to get your blueprint. If you feel like you're not being heard, start here. Understand your body first and then decide your next step.